I want to welcome you to our introduction video, Natural Solutions to Peripheral Neuropathy. I also want to congratulate you for being here. The fact that you are listening to me right now means you are actively looking for a solution to your chronic condition. What I have found over the years is what people want are the answers to two basic questions. Why do I have this condition, and what can be done to get my health back? First, I want you to know that you are not alone. This chronic disease affects millions of Americans. Essentially, it is a condition where the electric wiring is breaking down. The feet or hands don't communicate with the brain, or the brain does not communicate with the feet or the hands. There are 10 signs of peripheral neuropathy: numbness, burning, cramping, pain when walking, difficulty sleeping, loss of balance, sharp electric pain, weakness, and/or swelling. The symptoms depend on which nerves are affected, the motor, sensory, or autonomic. In part, this is what makes it difficult for doctors to diagnose, because not only are there multiple causes, but many symptoms could arise depending on which nerve is affected. The next part is the most important part, so I want you to listen carefully. It is what your doctors fail to explain to you the reasons why you have chronic pain. All chronic health conditions have some common threads. There has to be an underlying component such as diabetes, anemia, autoimmunity, or medication side effects. This ultimately causes a neurological imbalance, causing a decreased fire in the brain and nervous system, as perhaps fatigue and degeneration sets in. We always see a combination of neurologic and metabolic problems, and the ratio is slightly different for everyone. Standard medical treatment offers medications such as gabapentin or Lyrica. If I asked you to name me 4 things that would help you get your life back and help with chronic pain, would one of them be medication? The leading causes of peripheral neuropathy are back issues, which could be stenosis, arthritis, or a disc condition, diabetes, inflammation, chemotherapy, and statin drugs. Let me introduce myself. My name is Michael Veslak. I've been a chiropractic physician for over 30 years and board certified in integrative medicine and a certified functional medicine practitioner. I have a passion for helping people with neuropathy, as I unfortunately watched my father suffer before I had the answers. I've dedicated my practice to helping others with this condition and have successfully supported many patients with neuropathy. For a neuron to regenerate and repair, it must require 2 things: fuel in the form of glucose and oxygen, and activation, and lots of it. So we recommend specific exercise directed to the brain, spinal cord, joints, and muscles to affect the neuroplastic behavior. This is where our approach is different. We focus on the cause and not the symptoms. Once we find the cause, we provide diet and lifestyle changes along with nutritional support. Some key points that I want you to understand: it takes many different things to correct the problem. There is no magic bullet. You must address not only the structural, but the neurological and metabolic problems to have success. Our comprehensive nerve protocol is a 6-week course. This is an online program which costs $995. I'm sure you've tried several things in the past and you are thinking this is something that you've already tried. I understand completely how you feel. I have a lot of patients that have felt the same way. And what I found is when I supported the patient structurally, metabolically, and neurologically, improvements in their level of pain began to occur. The program includes online instructions on how to perform exercise to improve balance and the communication with the nerves. It will include dietary recommendations and specific tools to help stimulate the nerve and proper supplementation of nerve regeneration support. Most of our patients have been to several doctors. How many have you seen? Here are a few things that I want you to think about. On a scale of 1 to 10, how serious is your illness? Where do you see yourself in 3 years? Has it affected your relationships, your work, your ability to enjoy life? What 3 things would you do if you did not have this chronic pain? On a scale of 1 to 10, how serious are you about eliminating this? If you are not quite ready to make a change, then please do not consider my offer.